Hi, I'm Dr. David Jankowski from Summit Physicians Group. I have Dr. Jeffrey Wingate, board-certified spine surgeon, and we're here today to talk about the trauma victim and the impact on one's life. What is your thoughts on the trauma victim, and how would you approach this patient?
Well, the most important thing with anyone who comes to us in pain is that we have to come to some functional understanding of what hurts. And a lot of times the trauma patients will have torn ligaments, they could have torn or herniated discs in their spine, and to a large extent we get a history from the patient of what hurts. We have to understand how those injuries occurred, and then ultimately we have to do some imaging studies so that we can physically see what's broken or torn.
So what are the initial steps after the ER visit, and what does the patient do?
Well, one of the most important things, patients come to us in pain, okay? And from the very first time that we sit down with the patient, we have to be focused on treating or managing their pain. And to some extent that will involve the use of anti-inflammatory medications, quite possibly muscle relaxers or narcotic type medications if the pain is so severe. And while we're starting into this course of treatment, we then also have to do the imaging studies. We have to do the test, whether plain x-rays or an MRI scan. We have to come to that basic understanding of where we're headed in the long run in terms of returning this patient to normal function.
So does a plain x-ray mean that there's nothing wrong if it's negative?
Not at all. Plain x-rays in a lot of automobile accidents and a lot of other work-related injuries will be negative because the plain x-ray is truly focused on whether or not you have a broken bone or a badly malaligned, out-of-place joint. And so that's the primary thing that you'll get from an x-ray. So hearing that the x-ray is negative just means that you don't have a broken or misplaced joint.
So what are the advantages of an MRI imaging?
Well, the MRI scan gives us the option of actually seeing soft tissue structures. And when we talk about soft tissue structures in the human body, we're talking about muscles, we're talking about the ligaments and tendons that connect bones and surround joints. And for the most part, these are the injured tissues when a patient undergoes a traumatic type injury.
What's next?
Well, the first thing I like to do with a patient after an imaging study has been obtained is I like to sit down and actually go through that study with them. I like the patient to be able to see the injured parts. Then it's much easier to start focusing on a game plan for getting things back to more normal. Depending on how bad the underlying scenario is, will help us to gauge how aggressive we need to pursue other options. In other words, for the patient who is seemingly not making progress with physical therapy and anti-inflammatories by mouth, a lot of times we need to go to stronger medications. A lot of times we need to go from a non-steroidal anti-inflammatory into a steroidal or different type of anti-inflammatory medicine. We have to consider the fact that if we are going to then use a steroid medication, would we not be better off injecting that steroid at precisely the place the steroid needs to work, to exert its anti-inflammatory influence? Or do we need to completely change gears and go to some other type of treatment that will get at the root of the problem better?
So you're actually injecting the medication directly into the spine where the insult is?
Correct. Based on the MRI scan, we can see whether there's an injury to the disc. Here my thumb is touching against the front part of the disc between L2 and 3. And typically when we're talking about spinal problems, it becomes a little more difficult as I rotate the skeleton around backwards, but we're dealing with tears and or herniations along the back corner of the disc as the disc runs along the surface of the nerve. And that's where you get a lot of the inflammation and a lot of the pain. And so sometimes we're using a needle to selectively place the steroid medication directly into a close position where it can really have its maximal effect.
Then we go into what? Physical therapy?
It depends. Depends on how badly torn a structure is. A lot of times if it's not too unstable, yes, physical therapy will be the most immediate thing, and we have on-site physical therapy. We have the ability to get a patient into aquatic therapy, a heated therapy pool with a therapist who's very knowledgeable about their injury pattern. All those things can happen from the first week or the first day, sometimes even the first week the patient comes to our care.
I'd like to thank Dr. Wingate for coming, and he's been a great guest.
Well, thank you. Our focus remains on treating the patient. Patients come to us in pain, and the best thing we can do is to return that patient to quality of life with control of or elimination of their pain.